available to listen to after the fact if anyone wasn't able to join this morning. Again, my name is Bridget Budbill. I'm a program analyst at the Criminal Justice Commission. I'm going to share my screen with you real quick so you can see the presentation. And the way we've done this in the past, if you can use the chat box to ask questions, that makes a pretty nice record so I can see everyone's questions and make sure that we answer them. But you may also, just pipe up anytime you have a question if you prefer to do that. Can everyone see that PowerPoint?
Yeah, I have it up on my screen.
Great.
Yes.
Okay, perfect. Well, thank you for being here. This is about impacts, the improving people's access to community-based treatment supports and services program. And excuse me. So let's see here. So there it is. One thing that Julie mentioned that I thought was a good thing to talk about, when we were first beginning tribal consultations about this, months ago or a couple months ago, we didn't know how much a tribal set aside of funds would look like. So that was discussed on our grant review committee meeting on Tuesday. And the way the committee thought about it is the initial suggestion or request was that of the $10 million available, that there would be $1.5 million available for a tribal set aside. The grant review committee agreed that that was a fair request. And because of all of the COVID related potential budget cuts, what they've decided to do is, because 1.5 million is 15% of 10 million, if any of the impact funds are reduced, just because sometimes that has to happen, the tribal set aside would continue to be 15% of whatever the program funds available would be. So it would be the same portion, given the funds available. So we will continue to keep updated on whether there'll be any cuts to that $10 million, but I just thought it would be good for everyone to know that update. And I want to make sure we will be sending out a formal notice of that to Julie to disperse to everyone. Just still working on it. So.
Hey, Bridget.
Yes.
This is Julie. Sorry to interrupt you. I just wanted to check in real quick. Do you want to see who's all on the call?
Oh, sure. Yes. Thank you.
And I thought it'd be good if Karen wants to introduce herself too. Just do introductions real quick. So we can.
Perfect. Yeah. Thanks for reminding me to do that. So real quick for anyone who joined late, my name is Bridget Budbill. I'm a program analyst at the Criminal Justice Commission. And Karen, I'm going to unmute Karen. Karen, yeah, there you go.
Okay. I was going to say, I think I was unmuted, muted, and unmuted. So hopefully you all can hear me now. I'm Karen Can. I'm the programs director at the CJC working with Bridget.
And Karen, you're a co-chair of the Impacts Grant Review Committee too.
Correct.
Great. Do other folks on the call or the Zoom want to introduce themselves?
My name is Kate Grover, and I am a forensics program coordinator at Oregon Health Authority and also a staffer on the Impacts Grant Review Committee.
Great. Thanks, Kate.
And this is Julie Johnson, OHA Tribal Affairs. And maybe we could just go down the list to make it a little bit easier.
So it says at the top there, Angel. That's actually me. It's our login name for this. So we've got Kate, who is at 1-541-270-6118.
Marcy Muschamp with the Celeste Clinic, Celeste Tribe.
Thanks, Marcy. And Alex? Okay. Melinda? All right. Ruby?
Hi, can you hear me?
Yes.
Oh, good. This is Ruby, and I'm the Community Health Director for the Siletz Tribe.
Great, thank you. Angel?
Oh, is it working? Can you hear me?
Yes.
Angel Perrin. I am a grant coordinator for CJC.
Thank you. Erin?
Hi, this is Melinda Radford from Confederated Tribes. Sorry, we're working on a mass food distribution today and I'm listening to this webinar.
Oh, perfect. Thank you. Erin?
Hi, I'm Erin Otis, and I'm the grants coordinator for the Cow Creek Tribe.
Great, thank you. Okay, Kelly Rowe?
Hi, I'm Kelly Rao. I'm the Executive Director of Health Services for the Confederated Tribes of Grand Ronde.
Great, thank you. I think we're down to Kim Lane.
Hi there. I work in community health, in domestic and sexual violence services, and other needs that arise at our community health clinic for the Confederated Tribes of Siletz Indians.
Great, thank you. Monica?
Good morning, everybody. I'm Monica Yellow Owl. I am currently serving as the Behavioral Health Manager for Klamath Tribal Health and Family Services, Klamath Falls, Oregon.
Great, thank you. It looks like this is Sam.
Hi, my name's Samantha. I'm an administrative assistant for the Criminal Justice Commission.
Great, thank you. And Marcy.
I'm on my phone and my Surface. So I think I show up twice. Marcy Muschamp with Siletz Tribe.
Oh, okay, I'm sorry. And then I don't think we got Caroline.
Can you hear me?
Yes.
So this is Caroline Cruz. I'm with the Confederate Tribes of Warm Springs. I'm the Health and Human Services General Manager.
Great. Thanks, everyone. Okay. So I will get this presentation going. And again, if you have questions, please feel free to stop me anytime or put them in the chat box for later, whatever works for you. So this may be familiar to folks, but if it's not, just a quick overview about where this program comes from. This was a program created through a Senate bill in 2019 during the regular legislative session. And the funds here are really focused on persons in our communities who have serious behavioral health issues, mental health disorders and or substance use disorders, who due to their circumstances find themselves cycling in and out of jails or other sort of law enforcement engagement, emergency departments, or other sort of urgent healthcare crisis places for treatment, and or the Oregon State Hospital for institutionalization. The aim of this program is to fund additional services in local communities for those persons so they aren't winding up having their only interventions be law enforcement, the state hospital, or some sort of crisis center, or a crisis center that it's like an emergency department where they're not really getting their underlying needs met. So the goal of the funds is to support increases so that there are not shortages of those services in our local communities. And this program is open to both counties, Oregon counties, and Oregon's federally recognized tribal governments. So one thing that's, the decision makers of this program is this grant review committee. It's a 19-member committee. The tribal representative on this committee is Dr. Sharon Stanfill from the Cow Creek Band of Umpqua Tribe of Indians. And they've been working pretty hard on this grant for probably 6 months now to develop the RFP and the questions and make kind of a design for how awards will be funded. And as I mentioned a little bit earlier, there's $10 million available for program funds. The Grant Review Committee may set aside a portion for technical assistance projects, but they have not decided to do that yet. That would cut into those available program funds, and we'll see, once the applications are in, and I think once the Grant Review Committee can see how much funding was requested, it'll be easier for them to determine whether that's something they want to do. And so I'm sorry, it is a competitive grant program, not a formula grant for counties and regional applicants. And then there is in the bill a tribal set-aside amount. And I made this PowerPoint before our meeting, but that amount, that tribal set-aside funding amount, was determined to be 15% of available program funds. So currently that's $10 million, which would mean the tribal set-aside amount is $1.5 million. If the governor's office or the legislature requires any of that $10 million program funding to be sent back to the general fund, which presently we have not been told to do that, but we did have to do a budget exercise to reduce the amount by about 8.5%. So, $850,000. Regardless, whatever the total program funding amount is, once we've learned whether any cuts will be made, the tribal set-aside amount will still be 15% of those available funds. Additionally, if tribal requests come in and they are in excess of whatever 15% of the funds available are, the Grant Review Committee, it's not as though that's the only money available. The Grant Review Committee may decide that they want to allocate more to cover those requests. That's up to them. But at least that 15% of the available funds is the tribal set-aside now. Applications are due June 12th by 5 p.m. And let's see here. The eligible applicants are counties and federally recognized tribal governments. Counties and tribal governments may apply together in a regional consortia, or multiple tribal governments may apply together as a regional consortia. If you choose to, you don't have to. That is just one of the options. You can apply individually or as part of a group. So the submission requirements are that county applications have to go through the LPSC. Tribal government applications must be submitted by the tribal government. And a regional consortia, if you did have a combination of LPSC or tribal government applying together, you can decide, which body you want that application to be submitted by, either the tribal government or the LPSC, or if you have multiple tribal governments, whichever tribal government you choose to be the applicant, that's up to you. So what are the program priorities? Adhering to the statutory purposes, those are the things we just talked about, helping folks who are cycling in between jails and hospitals get better treatment that is going to help them, not continue that cycle. Tracking and evaluating the system data and grant-funded program outcomes. So, how many folks are you serving? How many hours of treatment are you providing? Those kind of metrics. Those are the things we want to be able to track so that we know what is really helping people and what to fund in the future. The next piece is strategically leveraging. $10 million sounds like a lot of money, but given the nature of the problem, we know it won't be enough to fully support every program idea out there. So how are we going to strategically leverage what funding is available to support programs that are interested and willing to participate in that data sharing and analysis piece, that have already done their sort of local system analysis to see what gaps do you have, what kind of comprehensive services will help your target population, and have you exhausted your local solutions and resources? Have you kind of done what you can do with what you already have? And then will the funding be at a level sufficient enough to really make sure that there's a significant impact? You don't want to just hand out little bits of money here and there, and then no one really has enough to do anything. So the allowable uses for program funds are pretty standard grant contracting budget category. So personnel for hiring folks, contractual services for personnel or some other kind of service. Rent and utilities is for program staff. So if you need to rent an office space to run a program out of, you can do that. Travel and training. I know travel is probably not something folks are going to be asking for a lot of, but if there's like a telehealth training that you wanted to use program funds for, you'd be, something like that would be allowable. Equipment and supplies, whatever you might need to support your program. Housing assistance, if you have participants in your target population who really need supportive housing as the means by which to support them, you can use funds out of here to pay for that. Other is kind of the catch-all if whatever you want to be doing doesn't fit into those top, prior categories, put it into other. And then administrative costs, I know it takes time and staff resources to actually administer grants, so you're welcome to use administrative funds out of this grant too. And here are just some allowable expense examples. This is not exclusive. This is just a list of examples. So if you're thinking outside of this box, that's okay too. So peer support services, case managers and care coordinators, like I said, tenancy or supportive housing services, crisis units, other just community-based mental health or substance use disorder treatment programs, you're welcome to use these funds for. Anything that's really diverting your target population out of the criminal justice system and or the emergency healthcare system to something that, is a program you'd be operating is on the table here.
Angel, may I ask a question? This is George Lopez. Good morning, everybody. Sorry I was a little late joining. I'm the general manager for the Klamath Tribes. I see you said previously that administrative fees were allowable. Does that include indirect?
Yes, sir. We have any other questions while we're here? Okay.
Yeah, this is
I think there was
Melinda Radford, Kuslam Kwasi Isla, and I was curious, I didn't see it, and I'm assuming probably not, but is there a match required for tribes?
No, there's not.
Hey, Bridget, this is Karen. There's a couple of questions in the chat box too.
Okay, thank you. Let's go to chat. Okay. I see from Monica, is renovation of a building an allowable cost? Yes, it is. The one thing I would caution is because funds are limited, I would be really specific as to why these are the only funds you can use to do that. And I would be sure to really explain why the renovation of the building is the appropriate undertaking to be able to serve your target population. So just be really specific as to why you would need to do that for your target population. Is that, let me know if that doesn't cover that question. Short answer is yes, you may request funds to do that in this program. And then from Kim, for tribes, a month turnaround is very tight. We require permission from our council. If we partner from a county, that must be also approved by the council. Yeah, so completely understand that this is a relatively short grant period for applying for, more of it's going to be kind of a complicated application in some ways because you've got a lot of folks to get involved. If there's any problem getting those pieces together before the deadline on June 12th, what I would recommend is just let us know, and we can do what we can to have the grant review committee accept applications either that say, we haven't had our tribal council be able to approve this yet, but we'll do that on this date. Just kind of do as much as you can to keep everyone informed, and we will be as flexible as we can. Let's see. Okay, so from Melinda, what if you don't have data on tribal members who access hospital? Does this grant require a tribal resolution? So for the first question, so you don't have to submit any data to be able to apply. And we'll go over this in the sort of latter half of this webinar for the actual data provided, but there is an agreement that you will have baseline data once you get your first funds disbursement. So what that means is in the application, you're going to check boxes that say, these are the kinds of data we think we could provide. And if you're awarded, then you would actually be asked to start collecting that data as your baseline. So what I'm saying is you don't have to have that now. We can also offer technical assistance to help you obtain that data. We understand that a lot of folks, one of the things that this funding is supposed to help is to bridge those data gaps that we know a lot of folks don't already work with, because it is really complicated to maintain, privacy laws and healthcare confidentiality and access criminal justice data. So if there's any way we can help you do that, let us know. And once we get to the online application, I'll show you that these are the kinds of questions we'll be asking about data. So what I don't want is I don't want that data to be a barrier for applications. You don't have to have it in place to apply. And then does this grant require a tribal resolution? The application doesn't require a tribal resolution. If your tribal council requires a resolution to, I guess, a sign off on applying, that would be kind of up to the tribal government. But no, we just, whoever submits the application, it just needs to come from the tribal government, and you can determine what that means to your tribe. Are there any other questions at this juncture? Okay, thank you very much. So unallowables, these are pretty standard. The big one is supplanting. So the whole impetus for this grant is to add additional capacity to programs that maybe you're already running, but you want to add new components to really serve your target population. So we can't swap out this money for other money. I know that right now a lot of places are going through really tough budget issues. So if you're in a circumstance where you are operating a program and you think that the only way it could continue is to use some impacts funding to support that, what I would recommend you do, like I'm staff, so I don't get to determine whether your proposal is or is not supplanting. That's up to the grant review committee. But what I would recommend you do is, if that is the only way you will keep an impact style program afloat, I would explain that in your application and just really tether it to supporting that target population. I think that's sort of your best bet for making that connection. And then let's see, I've got another question. What is the grant period for these awards? So the grant period is July 1st, 2020 through June 30th, 2022. So it's a 2-year period. It spans the biennium. Most of our grants are tailored to the sort of Oregon state government biennia. But because this one is getting started in the middle of a biennium, and also we were a little worried that if it was only a 1-year grant, like 2020 to 2021, that latter half of this 1921 biennium, people just don't have enough time to get a program up and running if the grant only lets you do it for a year. So that's why that 2-year period is what the grant review committee decided. Okay, and then other things like marketing, branding, lobbying, food and drinks, unless it's allowed in other sort of GSA federal per diem stuff, entertainment, that kind of stuff. So I keep saying target population. What does that mean? Target population are the folks who are going to benefit from these funds in your community. And the definition of target population for this grant is individuals who receive services and supports funded through impacts, who have 1 or more behavioral health disorders and are booked into jail an average of 4 or more times in 1 year, or are high utilizers of criminal justice resources, hospital or urgent healthcare resources, or institutional placements. So on the next slide, I'm going to talk a little bit more about what it means for those two ways to get there. The booked into jail 4 or more times in 1 year. If you have data and your folks are getting booked routinely into your local county jail, that's one way you can qualify your target population. But like many places, either you don't necessarily have that data, or maybe your high utilizers are not being booked. Maybe they're being intervened in a different way, either picked up by crisis services or maybe social services. But they're still having that frequent involvement with either criminal justice, your healthcare system, your emergency departments, your crisis units, or maybe they're winding up at the state hospital kind of over and over again. What you need to do there, if you're going to use that means for defining your target population, just to explain what that means in your community. it's really just an opportunity to detail what, why are your folks cycling through these services in a way that isn't helping them. So that's sort of the two ways to get to target population, and you are free to determine what that means for you within that definition. And also you may determine the size of your target population. If you think your target population is 15 people, that's up to you. If it's 50 people, that's also up to you, so long as they fit your definition of this high utilizers. And again, stop me anytime with questions. So the application contents, and we will be going over the application in a sec. A cover sheet with contact and fiscal information for who to reach out to if we had questions or need more info. A program narrative explaining your target population estimate. So who do you want to serve with this money? How did you determine who you'd like to serve with that methodology piece? And then local context. So explaining the circumstances in your local community that sort of lead to that target population either having the issues they do or local resources that you want the grant review committee to explain. Okay, so we got another question. Oh, okay, thanks, Angel. A data sharing plan description. So how will your program partners, the folks that you're going to be working with, maybe your tribal health center, who is going to be doing data collection? Who's going to be keeping track of your target population? There's also an available data checklist, and that'll make more sense when I actually show it to you, but it's like, what do you already know about your target population? Could you make a list of their names, ages, maybe whether they have a substance use disorder or a mental health disorder, those kinds of things. And then an agreement to provide baseline data. And that's what I was saying a little bit earlier about once an award is made, that agreement is to say, all right, now that we've been funded, we agree to take a survey of our target population and do kind of a baseline data of who's in it and what their issues are. The next piece here, community supports and services. That just means, what do you want to fund with your impacts money? Do you want a treatment nurse? Do you want to renovate an existing facility to make it more appropriate for treatment? Those kinds of things. And then this sustainability narrative, because $10 million is, given the nature of the issues, not that, it's not going to solve everything. What we're looking for there is, what else can you offer to sustain this program? Is it any local funding that would support staffing? Is it another grant maybe you're looking for? And it's not required that you are looking for other grants, but it's just an opportunity to explain how else will you support this program, both with impacts funds and then with other supports. Senate Bill 973 had its own requirements, which I'll get to next. And then a budget overview form, that's just, your line item. You want to pay for 4 staff and 3 trainings and that stuff. It's in a kind of a pretty standard budget sheet on the website. And then this last piece here, acknowledgement of additional requirements. That means you'll be okay with reporting financials and program progress over the life of the grant, which is, pretty standard for grant agreements. So the 973 required elements, these are 4 pieces that were in the bill. So the Grant Review Committee didn't have any option whether these were in the application. The legislature required it. So the first is letters of supports, and this is from community leaders or organizations who support houseless individuals in your community, your behavioral health care providers, CCOs or local hospitals. That is not an exclusive list. Your community leaders and organizations can, you can make that what you, who you see that to be. I would encourage, having healthcare, your healthcare folks involved would be a good idea, maybe social services. And I will go into more detail about each of these in the next slide. So I'll move on to medical assistance screening agreement. This is just, thank you. Medical assistance screening agreement is, you'll agree to screen anyone in your target population for their eligibility for the Oregon Health Plan. Tribal notification process plan. This is going to be really for, I think, more for counties, although I think tribal governments, this is something that if you have input on, it would be good to hear it. So the point here is for participating jails and hospitals to provide info about the risks and benefits to any person who identifies as a tribal member, and giving them an opportunity to notify their tribe of either their arrest or their hospitalization if they choose to. It's not required, but those program partners need to have that in place if that person wants to notify their tribal government. And then that last piece is county tribal government input report. This is essentially how did you reach out to, in this case, your local county government to see, this is what we're proposing for our impacts plan. Is there any input you would have on how you could support this or how this would work? You do not have to get agreement. The effort has to have been made to reach out. And the same is true of county governments. They are required to reach out to any tribal government with a service area in their county and reach out to your staff to see if, what input you could give them on their proposals as well. So letters of support, I know I covered this a little. Oh, sure. Yes.
Julie, sorry. I just had a thought about this the other day because counties are going to be wanting to reach out to tribal governments. So just for everybody on the call, I think we have 8 out of the 9 tribes on. If you want to let us know who that person should be, because I'm thinking we should let the counties know, or we're going to get questions from them. We did share the service areas with them, but they're going to, just so they're not calling, everybody in the world, if that should be the health directors or the behavioral health directors or the general managers. If you guys have thoughts on who you would like the counties to contact at your tribe, please let us know. I think that might be helpful, especially in the short timeline.
Yeah, thank you, Julie. You read my mind. I was going to ask you for maybe a suggested contact list for that very reason. So that would be great.
Does anybody on the call have any thoughts about that? Or if you want to think about it and put it in the chat box, that would be helpful, because otherwise I'll have to kind of poll the group. So if you can think of it now, just let us know.
Great, thank you. So for these letters,
also vice versa, do we already have a list of who the county contacts are?
No, but I will get that for you.
And this is George Lopez, and I apologize for asking this because I joined a little late. I was on a previous meeting, but I quickly scanned the slides and went back. So am I understanding this correctly? We can either partner with the county, which would probably be ideal, or we could compete with the county.
So I guess there's a couple ways to apply. One, if you are applying just as your a sole tribal government, you will have a tribal set aside funds. So that is it's not competitive in the same way that counties would be in the remaining program funds, because there is that set aside that is guaranteed to at least one tribal government. And maybe more. It's up to the grant review committee how many awards there are and how many applications come in will determine that. But if you were applying with a county, you would be considered a regional consortia, and that would be, you would be then in that sort of regular program funding pool, so it would be more competitive. But I would say that I think that any application that came in from a county tribal government joint application would be pretty competitive, because that is something that I think the legislature was hoping would happen. I hope that answered the question. So there is a tribal set aside funds for individual applications, but regional consortia would be kind of competing with the larger pool. Did that answer your question?
Yeah, and they're just curiosity. Do you know what was set aside for tribal applicants?
Yes, sure. So right now there's $10 million available for program funds, and the grant review committee determined that tribal awards set aside will be 15% of program funds, so $1.5 million presently. It is possible that the $10 million may get a cut because the governor's office has asked all executive branch agencies to look at cutting their programs by 8.5%. So we did an exercise that would show what it looked like to our agency if we cut 8.5% off of everything, including impacts, which would be $850,000 less. Nevertheless, that cut hasn't been made yet. It's just an exercise. But if it does happen, the tribal set aside will still be 15% of whatever program funds remain. So there'll still be that same ratio, even if the available program funds decrease by a little bit.
So and I'll be quiet after this. I apologize.
No problem.
So if we were to apply together with our county, would we then fall into the 85% of the funding, or can we still apply together but hit both buckets?
So if you applied as a regional consortia, you would find yourself in the 85% pool of program funds. You may also submit an individual tribal application if you wanted to do both. So you're not limited to either or. So that's one way. And I also would emphasize that if tribal applications requests exceed that 15%, if there's more requests than the 15% of funding is available, the Grant Review Committee may allocate more funds for that tribal set aside. It's not as though that's it. Did that answer everything? I want to make sure I'm actually answering questions and not just talking.
That was good. Thank you.
Okay, thank you. So for letters of support, I know this can be kind of a lot of work to do in a short period. So if you choose, you can draft one letter and have multiple signatories so that you're not trying to get a letter out of every person you'd like to support your program. That hopefully will save you a little bit of time. For the medical assistance screening agreement, and this you'll see on the actual web page, this is just an acknowledgement that you will do this. You don't have to submit anything in your application or a plan or anything. If you are awarded funds, this piece will be part of your sort of routine reporting. How many folks did you screen for OHP in the last 3 months? 15, those kind of things.
I just had a couple questions on the letter of commitment. Oh, sorry, this is Melinda Radford from CT Clusie. On the letters of commitment, letters of support, I noticed that it was a dash, and I'm always cognizant of that because I work with a lot of different federal agencies, and some require a specific letter of commitment, almost like an MOU, and then some just require a letter of support, hey, I think this is great, I'll totally support you. So I'm wondering exactly if you can clarify what you're looking for. And then on the second piece with the Medicaid, so our behavioral health family support services, we don't currently screen for Medicaid, but our purchase and referred care program has a stipulation that each tribal member has to apply for Medicaid regardless of income each year. So we will not be screening for Medicaid, but our tribal members are screened yearly for Medicaid eligibility. Can I list that?
So for that question, what I would do is when you have your members of your target population identified, I would just make sure that you explain that all of those members have been screened for Medicaid by whatever, your process on an annual basis. That's how I would address that. So the screening is happening, even if you yourselves are not the ones doing the screening. So it sounds like you're meeting that requirement already to have all your target population members screened. And for the letter of support commitment, that it can be kind of whatever you want it to be. It can be a letter that just says, "Dear so-and-so, we support this program, yours truly." It does not need to be as formal as an MOU or an MOA. If you wanted it to be that formal, you're certainly welcome to, but no, there is no requirement that it be some sort of, binding document. It can be a supportive letter. All right, other questions? This county tribal government input report, the legislature required that any applicant essentially show how they reached out to their either local county or tribal government with a service area in their county to explain how they garnered some input on, hey, this is our impacts program. This is how we plan to operate. What do you think? Do you have any suggestions about how this might work a little bit better? I will say that if you are a regional consortia applying as a joint county tribal government application, you don't have to do this, because by the very nature of your application being joint county tribal government, you have already done that sort of cross collaboration. It's sort of inherent in your application. But if you are an individual tribal government applying, that is something that will have to be done. And I know report has kind of a serious connotation. The report does not need to be a formal report. It may be a letter that demonstrates this is what we provided this information to this person. This is what we heard back. Or it could be an email or a series of emails that just show that that effort was made. I know this can be kind of an onerous requirement. It was in the bill, so our grant review committee wants to make this as sort of doable as possible given the time period. So that's why it really does not need to be a formal report. It just needs to show that some effort was made to just see if there's any input that could be garnered. It also doesn't require that anybody agree. If you don't agree with the county suggestion, tell them that, or vice versa, and that's good enough. That just needs to be the effort of it having input garnered. Hopefully, it will be a good thing, and there could be some real, so good input that will make the program work better. But you aren't required to agree or endorse anything if you don't want to. And this is this is really more helpful, I think, for county governments who maybe weren't sure which tribal governments had service delivery areas in their counties. So for tribal governments, it's really, what counties are your, what county sort of boundaries are you in, or, especially if what county jail would any of your target population be booked at? I think that's the way to think about it, as to which county you would need to reach out to if you're planning to apply. And if you have any questions about clarifying this, I know the bill itself was not terribly clear about how this sort of consultation should work between tribal governments and county governments. So if you have questions, please let us know, because we're happy to try and make it clearer than it began. So, and again, stop me with questions anytime. The tribal notification process plan, this is really, I think, probably makes, I think the thinking here was, particularly for county jails, if you have a member of a target population who is booked in your jail, it also applies to hospitals who would be participating, maybe admitted to your hospital. You have to have a plan described about how you're going to let that person have the opportunity to notify their tribal government if they wanted to. And from what I've heard from county jails, most county jails don't currently have something like this in place. So they need to have, if they don't have a plan in place currently, they need to develop one. And if they are funded, they have to have that plan implemented prior to their first disbursement of funds. This piece may in particular be a time where counties reaching out to tribal governments could really help make that plan better, because, I don't know that necessarily county jail commanders are going to know, the best way to carry this out if it's new to them. So that might be an opportunity for some really good collaboration. And again, let me know if you have any questions about this. So program review criteria, first is really completeness. Did you answer all the questions? Did you include the information that was asked? The second piece is program narrative and your local system assessment. So how much did you explain, what your program priorities were? What were you really trying to accomplish with this funding to reduce the times that your target population folks are going to jail or the emergency room or the state hospital? And how well did you really assess kind of what you're already able to do? And a big piece of this is how well did you explain who your target population is and how you're going to keep track of them and their successes. And then, of course, the last piece there is how are you going to engage your program proposal, what you want to be doing that's new with the things that you're already doing with behavioral health or criminal justice diversion or those sorts of things. And then the third piece is sustainability. And I talked about this a little bit earlier, but what are the other ways you can support your impacts program, both with impacts funding and then other sources, either staff time that's paid for by tribal government funds or other grants or those kinds of things. And then that last piece, the grant review committee may consider other factors, as the applications come in. One may be geographic diversity, just as an example. If it looks like a lot of the applications are coming from one side of the state, they may decide to add an additional factor that making sure the funds are spread across the state more evenly. That could be a factor, but currently it's not. That's just an example. So interested parties, if you are not on the interested parties list, I'd be happy to send you more information. It's kind of how I get everybody kept up to date. I do have a copy of the online application in Word, which is a little bit easier to share with people. So I'd be happy to email that out to you all if you want to get on the interested parties list, or I'd be happy to share it with Julie and ask her to send that out too. So whatever works for you. This is my email. My name's Bridget. So feel free to copy that down. I will also make sure that you all get a copy of this recording so that we can, so if you want to visit it later, that's fine too. So next is, I'm going to stop sharing and I'm going to go to the online application. So let's see here. So this is in the RFP, there is a link to our grant management website. This is the website that you'll use to actually apply for the grant. So I'm going to log in. Okay, so I'm going to go through this as an applicant and show you what the online application looks like. And hopefully, just answer any questions for folks who may be new to this website or just have any questions about the actual formatting of the online application. So here, this is the cover sheet. This is what we were talking about a little earlier. And I will say I used, sorry if this is goofy, I used rabbits and pet names just so that there wasn't any confusion about whether this was using an actual county as an example or a tribal government or anything like that. I see I have a question. Okay, thank you, George. So the first things first, who is your grant application contact person? So this is, if you submit your application and it looks like maybe one of the attachments didn't work, who will I call to make sure that I can get that information from you so that your application is submitted 100%? So that would just be, the tribal government name, the contact person, email, phone number, all that good stuff. This next piece here is participants. So who in your community is going to be participating? Either, your local health department, maybe your social services department, maybe your tribal police if you have one, and I think only Warm Springs does, or maybe your local municipal police. So anybody you would want to participate, put that here. So for this top one, it would just be the tribal government name or tribal governments. And then down here, you would put the sort of entities that would be participating as either healthcare or law enforcement, like healthcare here, law enforcement here. And if you don't have a law enforcement agency participating, that's okay. It's just the opportunity if you do to add one. You may just have healthcare and social services involved. That's fine. This would be where you put other agencies or organizations. If you have reentry services or other sort of supportive, supportive tenancy services, those kinds of things down here. And then your grant team fiscal contact, sometimes that's going to be the same person as the primary grant contact, but in some circumstances you might have a business administrator who would be the person who coordinated funding or had any questions about direct deposit, those kinds of things. So you'd put that contact person here. And then direct deposit, if you want direct deposit, you just click yes, and we will make that happen in the grant agreement. So that's the first page. Does anyone have any questions about cover sheet?
Bridget, I was just going to let you know, a lot of tribes have tribal police. Warm Springs has jail. That's what you were thinking of. Yeah.
Yes, I'm sorry. That's right. Thank you, Julie. Sorry about that.
That's okay.
Okay, so great. Thank you. So if anyone who would be involved, yeah, you would just list who was participating with you. Okay, so this is the program narrative piece. This is where you essentially explain what you want to do. And this is a lot of text. This is just copied from the RFP. So this isn't new information. It's just kind of re-explaining. This is what your target population is. It's that definition we went over with 4 or more bookings in a jail or high utilizers of other resources. So the actual questions here, the first question is provide the number of individuals eligible for inclusion in your target population in number form. So this is where I just did this as sort of an example. I put 40. For you, that may be 15, 10, 5, 25, whatever it is, you just estimate. If you know exactly how many people, great, but you may estimate if you aren't exactly sure. And then the next piece too here is the methodology used for identifying them. So you can either pick 4 or more bookings or high utilizers. And in this example, I selected high utilizers. So this is where you would just say, this is how I'm defining my target population. And then in the 2B, this is where you would explain what high utilizer meant to you. So, and I didn't actually write out real answers to these, but you may use, crisis intervention contacts made, the number of times a person has been picked up by your law enforcement, taken to a sobering center or a shelter or other facility. That's what you would describe here. Number 3 here is any other critical local context that you think the grant review committee should know. My thinking here is that, how should you describe your target population in the ways that make them unique? Like, what are the vulnerabilities that your target population face? What are the conditions that make them particular to your community? What are your local resource challenges? What are the real barriers to your target population locally? I would use that explanation here to sort of support why your target population needs this help. The next piece here, data sharing plan narrative. This is how you will kind of keep track of your target population and your grant program. So who will be participating and collecting what? Is your grant staff going to be tracking the number of target population members you have? Like was suggested earlier, you're going to be pulling from the Medicaid screening that's already performed and identifying who within your target population has already had that performed for them, those kinds of things. So who's going to do the tracking? What can you track and how will you develop that plan? So that's just something you would describe here. You don't necessarily have to have all of those plans implemented. It's just what you would do if you were awarded these funds. So I know that there's a lot of data can be really challenging to organize. So like I said, it just needs to be what you plan to do. And so here, this is the data points that you select. In the actual live application, you will see a checklist of available data that you could check. It could be tribal affiliation, it could be age, it could be gender, substance use disorder, behavioral health disorder. You would just check any of those that apply that you know already you can identify within your target population. For the example here, I just checked age just for the sake of simplicity. You can check as many or as few as would be applicable. There's also an other category. If you have another data piece that you do track that you'd like to add, you can add that there. The target population baseline data. This is all you do here is accept. This is a box you would click that says, if we're funded, I will start tracking my target population and let the grant review committee know sort of the baseline of folks involved to the extent we can. So let's say we have 10 people. We're going to identify whether those 10 people have a mental health disorder or a substance use disorder, their age maybe, whether they've been booked in jail recently. It will be de-identified, so you don't need to worry about violating anyone's privacy. But just those are the things that you would need to acknowledge tracking internally to participate. And again, let me know if there are any questions about how this would work. I know it's all kind of abstract when it's theoretical, but yeah. Let's see here, community supports and services. This is where you're explaining what you want to do with these funds. So here I just put a description of, what supports and services you're requesting and what would they pay for? How will they provide funding for, capacity building for the supports and services you want to help your target population? So I would really focus on, how are you going to keep your target population, how are you going to give them better opportunities to not wind up in jail or in the emergency room or the state hospital with these funds? The program sustainability narrative is, kind of as we were describing, what funding streams already exist to support your target population? Are there local, state, federal, nonprofit funds that you're sort of weaving together to support them? And where would impacts kind of fall into that? I also should note these boxes on the live form that you'll see when you register and start an application, they can be as long as you want. There's no word limit. They can also be as short as you want. It's just up to you, kind of what you determine to be enough detail to explain your proposal. So I don't want to give anyone the impression that you only get 3 sentences. That's just the example. And then this medical assistance screening agreement, this here is just a checkbox that you click to say, yes, all of our target population members will be screened for Medicaid or, the OHP eligibility. This next piece here is acknowledgement of additional requirements. Like I mentioned, that is just saying you click a box that says, yes, I accept if we are awarded funds, I will provide financial reports and program progress reports on, the iteration that the grant review committee requests, which will probably be, this is just a prediction, probably quarterly for financials and maybe quarterly or biannually for program progress. But that's a prediction. They could change that. Budget overview. This is essentially, this will be on your second page, and this is where you do your line item request form. This is what you want to have funded, and you've got all of the categories that we described earlier: personnel, contractual, supplies, that kind of stuff. So this is just how you would actually fill this form out. If you want to do peer support, you would just add in their monthly wages, salary plus fringe, how long you think they'd be employed over the grant period. If it's going to take you a little time to hire them, I wouldn't put 24 months, I'd put 20 months. This is the percent of the time they'll work on this program, 50%, and then the employing agency. And if you wind up having not enough fields, if you are going to, your proposal has more than 5 positions in it, just let me know and we can open up more fields for you. This here is new hiring. We just want to make sure that if you're hiring new staff with grant funds, will you agree to post the positions within 45 days of your award? That's just to let us know that, we don't want the money to be sitting there if it could be used elsewhere. So just making sure that hiring process gets started. This is, in the past, we've had an issue once or twice with, funding entities to hire staff, and then they didn't really try to hire them for like 6 or 7 months. So we want to make sure that doesn't happen again. And then new hire positions filled. If you're hiring with grant funds, will you, in your reporting, let the staff know that that position has been filled? And you don't need to send anything formal. It could just be an email, or you could just include it in your next report, just so that we know that that's happened. So really, I don't want that to sound more onerous than it is, because it's really not. It's not intended to be, at least. Contractual services, these are just examples. If you had a jail treatment nurse or a nurse in your behavioral health clinic you wanted to fund, you could do that here. Equipment, and each of these fields has sort of the description of how you would fill in the form, but I hope it's user friendly. If you have any trouble with this website at all, please just call. I'd be happy to give out my cell phone number. My desk phone is currently forwarded, and I'm not convinced it always forwards. So at the end of this, I'll make sure everyone has my email and phone number. So if you do have any trouble with the website, you can reach me quickly. Again, travel and training, if you wanted to do some sort of workshop, it doesn't have to be telehealth, it could be anything related to serving your target population. You would just fill in the number of registrations, the total fee that it would cost to send those folks or to admit those folks to that training, and then travel expenses. Recently, it's probably going to be pretty minimal. And then the agency or entity served. I will say, if it says agency, that's just, it doesn't need to be necessarily an agency. It could be an entity, it could be an organization. Agency, we don't get a lot of room to title these boxes. As you can see, they're kind of crammed. So we just use kind of a catch-all term. Rent and utilities, this is for your program staff space if you need it. Housing assistance, this is for any supportive housing or tenancy or rental supports that you would be looking to support your target population with. Other is anything you're proposing that doesn't fall into these other categories. And then administrative costs. This would be, whatever indirects you're looking for, and in the fields here, you would just, describe what you are using it for and then the amount you would need over the grant period. So that is the narrative and budget form, and I hope I didn't go through that too quickly. Like I said, I'd be happy to answer any other questions that you have once you're actually going through this. And then I just real quick wanted to show you guys the other pieces. So when you're submitting your letters of support, this is how you would do it. You would just attach a file here and upload whatever, either one letter or multiple letters, however you want to do that. You would attach that here. There is a link to video. You're welcome to link a video if you want to. That's just a, that's an extra. It's not required at all. Same process for consultation report and tribal notification process plan. See, I have a question. Was there a section for indirect rate on the budget breakdown? No, there's not. If you wanted to submit additional info about administrative requests, you're certainly welcome to, but all the budget form asks is just sort of a general, do you want administrative costs covered? And if so, what are those costs? And for the consultation report and notification process plan, it's the same format. You would just upload, if you had an email or a series of emails with, a county government, you would attach those there. If you have a hospital you're working with that maybe hasn't done this sort of notification process before, you would attach that here. So it's just file uploads. And once all of that was done, you would hit submit or mark as complete, and then you could submit. If you have anything where you've already submitted your application and you're like, oh man, I really want to change that, or something in your proposal is shifted, as long as it is before June 12th, the deadline, June 12th at 5 p.m., you're welcome to go back in and make changes. And if you have any trouble doing that, just let me know. That is my presentation for you all. Is there any, can I answer any other questions for you guys now about just any of the stuff we covered?
This is Monica, just about the defined target population. So if we're choosing, say, 20 individuals, those are defined individuals, right? That we would be tracking through the grant period specifically?
Yes.
Okay.
So the way that would work is you would identify your local target population. You don't have to tell the grant review committee who those people are, but you would want to keep track of them just to report on progress and hours of treatment received and all that good stuff. So yes, that's who you determine. Are there any other?
My next question is this adult 18 and over, would this also include, or would this be able to include juveniles?
My understanding is the intent is for adults. I would be happy to double check, but in all of the conversations the grant review committee had, that it has been for the adult population. Are there any other questions? If not, here's my email again. I'm happy to help anytime, so please let me know. I don't think I saw any, let's see, make sure we go to the chat. I'll work with Julie to make sure that we get the sort of contact lists developed so that county governments aren't reaching out to folks that they shouldn't be, or so that they make sure that they're reaching out to the people that really need to be contacted, and so that you're not just getting a lot of random emails or anything. And I will get you all a contact list for counties as well. All right, that's all I had. Does anyone have any last thoughts or anything they want to ask? If not, thanks everyone for your time. I hope you have a great morning, and let me know if you have any questions going forward. Thank you, everyone. Have a good day.
Hey, Carmen over there in Warm Springs, is that you? Thanks, Bridget.
All right, thanks, Julie. Thanks, everyone.